All right, welcome back. So now we're going to talk about diagnosis, our medical side. The first one I'm going to talk about is COPD. COPD is chronic obstructive pulmonary disease. Pretty much it's when your lungs go bad. It happens a lot with people that smoke, have smoked for a long time. It's all emphysema, bronchitis, all of that's COPD. These people might be on oxygen. You might see them, they can't breathe well. So when you think about it, why would these people need care buddies? Most importantly, they can't do a lot because they get short of breath. And a lot of times they can get so short of breath that they can pass out. So CareBuddies is good, for that type of situation because we can help monitor them. We can do things for them so they don't get short of breath. And we can just prevent them from going back to the hospital because they are in the hospital a lot. So if you have a patient that has COPD, this is just a brief introduction of what that is. The next diagnosis that we're going to talk about is depression. Depression affects a lot of people, and we all may have a little bit of depression. We might feel sad or something for a period of time, but there are a lot of people that are depressed for a long time, and it really bothers them in a way that sometimes they have to take medication. Most of the time when you think of depression, you're thinking sad, gloomy, don't want to get out of bed, don't want to do anything. And that is the main, part of depression. But some people, depression affects them differently. Oftentimes when you're depressed, when this type of people are depressed, they get angry, they get violent. Some people, they get suicidal. Sometimes they just, kind of talk a lot and things like that. So, you don't always, when you think of depression, don't always think sad and gloomy because it can affect people differently. But let's think about why would someone that's depressed need care buddies? Lots of reasons. Companionship. They need someone that's there to be supportive, to be positive, just to kind of help them, feel better and things like that. And I always say our job is not to preach. Sometimes, people have gotten themselves in certain situations that, they don't need to hear, oh, you shouldn't have done that, that's why you're in this situation now. We're there to kind of be a support system, more or less a preacher. And sometimes people just want someone to listen to. So I always say sometimes do a little less talking and more listening. And that actually goes a long ways and it helps the person feel better. But sometimes you might have a client that's suicidal and you might just have to sit with them to monitor them to make sure they don't hurt themselves in any way. This can be in the home. You might have to go to the hospital and do this. This can be at a facility. It really, it just depends. Our next diagnosis that we're going to talk about is obesity. And I'm talking about more like morbid obesity. Like these clients that are like 600 to 1,000 pounds. And yes, I've worked with some and, they are out there. So mainly with these type of clients, because of that they're not mobile or it's difficult for them to be mobile. So we're there to help them do the things that they can't, their housework, kind of monitor their diet if that's one of the things that they requested. Sometimes a little bit of motivation or, just some companionship activities. The next one is chronic pain. And this affects a lot of people. It can be a car accident that happened recently or in the past. It can be, what's that diagnosis I'm looking for in my mind? It can be fibromyalgia, it could be sickle cell, it can be lupus, it can be cancer. All of those types of diagnoses, people have chronic pain. So a lot of times when you're with one of these clients, you have to monitor them medicines. First of all, you want to make sure they're not abusing the medicines, and then often you want to make sure they're taking the medicines. Some people just don't like to take medicines, period, but they're in pain, so you might want to kind of encourage them to take it. And then we might have a medicine list that someone's supposed to take something only twice a day, and you're noticing that they're taking it way more than that. So that needs to be reported. But those are some clients that you might deal with as far as chronic pain. With chronic pain, it could come in spurts. One day they might be up, doing things, moving around, happy, and the next day they're too sore, they're too much in pain to get out of bed. So that's what we are there for. As a care buddy, you're there to help them out, to do whatever it is that they need help with at that moment. Our next type of possible client is the elderly. When you think of a home care agency, that's a given. Of course, that's a given. So when you get older, you can't do things fast enough. Sometimes you're not strong enough to do things. Sometimes your memory starts leaving. So we're there as a support system, and again, to help them in that type of situation. With elderly becomes Alzheimer's, and that's very popular and very common diagnosis that we might work with. With Alzheimer's, it's a memory type of thing. Sometimes you might have to do the same exact thing with these clients over and over and over again, like over all the time. And with this type of disease process, a client can sometimes take themselves through the same memory all the time. It could be a sad memory, which is not, great. I've had an Alzheimer's client that took herself through the memory of her husband's death, and she did that several times a day. And it was very, very sad to have to kind of feel like, she had to go through that so many times. But Alzheimer's is a very common, diagnosis that we may be working with. And pretty much they can get to a wandering state when they wander and they're just not mentally where they are. And you really have to watch this type of person for safety and making sure they don't hurt themselves and things like that. Other diagnoses that we may have is brain injuries. Sometimes the brain injuries are kind of like Alzheimer's, and this can affect a senior, it can affect a child, it can affect a middle-aged adult, it can affect anybody. Brain injuries are all different. Different parts of your brain work differently, and someone may be injured up here, someone may be injured back here, and those different parts of the brain work differently, and if they affect the person differently when it's injured. So, but with your brain injury clients, the main thing I can say is, some of them may be forgetful. Some of them remember everything, literally. Things you can't remember, they remember. Some of them, it affects them and they think they're a little bit younger than what they are. They might be 40, but they might appear like they're 12. That might be where their mental state has put them. So mainly with your brain injury clients, just, we're there to, most of the time it's companionship with them. A lot of the concerns I get from them are, I don't feel like I fit in anywhere, So, we're there to kind of offer companionship and also monitor for safety and things like that. You might have a cancer client. With cancer, you're taking them back and forth, sometimes for chemo or the radiation treatment. You might have to sit with them, at their chemo, while they're getting chemo. When they get home, they're a little bit weaker, so you have to kind of just help them, along the way, fix them something to eat, maybe clean up for them because they're weak. That's a lot of medical, our medical clients. It can go on and on and on because there's a lot of diagnoses out there, but I just wanted to cover some main ones. Alrighty, thank you. Bye.